Transmissions among children and teenagers have been on the rise here on the local front, accounting for over 700 cases on a daily basis in recent days, as my colleagues and I mentioned earlier on. For more on this unsettling reality, I have Professor David Kwok from Suncheon University. Welcome back, Professor Kwok.
Good afternoon, Sunny.
I also have Professor Sarah Okshin at Korea University live on the line. It's good to see you again, Professor Shin.
Thank you for having me.
Professor Kwok, we'll start here in the studio then. There is a rather disturbing prediction about transmissions among teenagers, with some saying that transmissions could, or 40% that is, of Korea's youth will eventually be exposed to COVID-19 given the current trend. Do you share this outlook?
Well, I actually don't share that outlook with the person who ever made that. I think it's a bit too extreme to speculate that up to about 40% of the total population of the youngsters could get infected. There is still great chance that the growing numbers of those youngsters could still be exposed to the virus and also get infected. At the time being, I think we're clearly seeing those younger age children, even among themselves, even the younger people or younger children who haven't been vaccinated so far are coming up with a lot of numbers of infection. I think even in the group, high school graders in their first, second, and third grade have been vaccinated much more than their middle school children and also even younger children. And they seem to be showing infective case numbers differences even in those age groups. So I think middle schools are currently composing the largest numbers of the children coming up with infection, followed by the elementary school kids, but also it is also showing much lower numbers of high school kids to come up with infection. So I think it clearly shows whether or not those people who are vaccinated are clearly protected from having COVID-19, as opposed to those people who aren't vaccinated are showing much, much higher numbers of infection as well.
Right. Professor Shin, aside from vaccination then, what else do you believe is fueling the outbreak among children, especially those aged 12 to 15?
So yeah, as Dr. Kwok has said, the majority of confirmed cases in children were actually found to be not vaccinated or have not completed 2 doses of vaccination. Also, if you look at the vaccination rate for kids, the rate of secondary vaccination at age 17 exceeds 70%, but the rate of primary vaccination at age 12 to 17 is only about 50%. And so this is quite low number compared with over 80% of secondary vaccination completion for adults. Also, children have been fully back to school since November. And they tend to spend a lot of time together in groups in crowded areas. So that means a higher chance of getting, transmission of virus and getting infected. And many of children also have asymptomatic infection. This makes the early detection of the virus very difficult and may contribute to spreading of the virus among their families and friends. So all of these factors are definitely affecting the increased numbers of COVID-19 cases in children and teenagers.
Right. And Professor Kwok, what can you tell us about critical cases involving young COVID-19 patients here in the country?
Well, so the KDCA is not really putting out too much information on how many of the children are actually being contained because of their severe COVID-19 progress. But I can attest to a single case which I've experienced last week where a close friend of mine whose daughter was admitted to one person's negative pressure isolation booth because her symptoms were not getting better and actually getting worse despite her being only 11 years of age. So it is not obsolete. It is not none case that this is happening. Children do have the possibility of becoming more severe in their progress. So that's something we definitely need to look out for. So far, we've had no cases of death in the age group of teenagers, but we've had one or actually a couple of cases with severe underlying diseases who sadly died of COVID-19 infection. I think if the numbers actually grow, just because of the expansion of the numbers, we might see further severe cases and possible mortality even in younger age groups, as we have seen globally in European countries and also in the US. But that's something we should be able to prevent because as opposed to those European countries or the US, we have the capacity to inoculate these children with higher education. We have much better compliance from the nation's citizens as opposed to many different countries all over the world. So if we were to give better, more factful information and also better education towards parents and also the children themselves who are eligible to receive vaccines, I think we will reach higher points of vaccination rate as well.
Right, and staying with vaccinations, Professor Shin, we've been told that the gains outweigh the risks with regard to COVID-19 vaccinations for adults. Now, do these words hold true for young teenagers as well?
Yeah, I mean, the bottom line is that vaccination definitely prevents the severity associated with COVID-19 cases for both adults and children. And if you look at the data from other countries where they have higher vaccination rate for children and teenagers, for example, in US, the vaccination in teenagers reduced the hospitalization rate by 90% and the mortality rate by 70%. Also, Israel reported lower hospitalization rate by 90% and the death rate by 80% by vaccinating teenagers. And compared with these countries, in our country, Korea, it was found that the rate of severity of COVID-19 was reduced about 40% so far. But this number may change as we increase the vaccinations in children and teenagers in the near future. So kids are definitely better off to get the vaccination because the benefits of vaccinating kids against the COVID-19 far outweigh the risk of severity associated with COVID-19.
Right. Professor Kwak, one of the main concerns among parents, that is the potential post-inoculation adverse reactions that their children might be exposed to. Now, authorities have said fewer cases of such adverse reactions have been reported among children here in the country. Having said that, what can you tell us about the link between age and perhaps possible vaccine repercussions?
Well, while I would have liked to say that there's much less chance of side effects among younger children, but that is not entirely the case depending on what studies or where the studies came out of. Apparently, Korea has stated that there is about half the chance, or less than half the chance, that the children would have side effects from getting inoculations in Korea. But according to CDC, or the numbers that they have put out actually show slightly higher rates of feeling feverish right after the inoculation. But even despite having that number, it's still very low of the percentage of the people who receive the shots. So I would like to iterate that kids who receive inoculation would be receiving it at a much lower dose to begin with. But also, even if the numbers show, let's say, about 10 to 20% of the people who would show, let's say, mild fever right afterwards, these are what happened with millions of people who received vaccines in their adulthood and also much elderly generations. So it would not differ for anything we have seen with older generations. And this should not become worrisome just solely because they're younger. Now, that being said, I am also a father of 3 children who are aged 4, 6, and 8. When they become eligible to receive the shot, I definitely do plan to give them shots, despite sharing the worries of the parents who are worried about having to go through side effects. Because I know for a fact that even the side effects occur, they're mild. Even the most severe forms of side effects currently stated, such as in myocarditis, those children who's had it went through very mildly and were treated right after, and they were all manageable with mild doses of medication. So I know for a fact that even when my children get their vaccines, they would be okay, but in the end, they will be absolutely protected from the infection. So I would definitely choose vaccination over not being vaccinated.
Right. Professor Shin, Professor Kwak just mentioned myocarditis. Now, what can you tell us about the treatment procedure for myocarditis after vaccination?
So I kind of want to add a few comments on Dr. Kwak's comments. So I totally agree with Dr. Kwak, and rates of suspected adverse reactions among teenagers actually after vaccination was about 0.28%, which is lower than 0.37% of adults. But this number may change as we increase the number of vaccinations in children and teenagers. And similar to adults, teenagers mainly complained of common adverse reactions like the pain in the injection sites, fatigue, and headache. And there were about 12 cases of anaphylactic side effects, but all of them have recovered now. I know many people are worried about the risk of myocarditis getting, after vaccination, but I must say that, the severity of myocarditis is actually a more important issue than the occurrence itself. According to the reports from the US, even if myocarditis occurs after vaccination, most of the heart function returns normal within a week, and the prognosis is good. So, but I must mention that, US just started vaccinating children the age of 5 to 12 groups. So we can definitely take lessons from US data and evaluate if there's any risk or adverse reactions associated with the vaccination in children under the age of 12.
Right, that is good to know. Meanwhile, Professor Kwok, there is much national controversy here in the country over plans to require teenagers to share proof of vaccination to access education-related facilities outside of schools come February next year, of course. Now, before we delve into the national debate, do tell us a bit about similar requirements elsewhere.
Right, so I would like to share some information what's happening globally with so-called vaccine passes and their requirements and according to the country. It seems like a few of the European countries are mandating all green passes to be required for any public spaces that exceed certain number of people gathering, or in cases of public space, whether it's a public space or not, such as in France requiring green passes to be required for all those who, when there is 50 or more people are gathering. For Germany, I think they're requiring it to all public spaces, including bars and restaurants. But so the idea of green pass actually differs from what we are trying to mandate in our country. So I want to point that out here because I think the factual information is the most important part of having to making the rightful decision. So these green passes are given to people not only who are vaccinated, but who are deemed immunized after the infection. So these green passes, whether that be for younger children or to even adults, they're given when they're deemed to have been immunized against the infection, whether they are through natural immunization or the vaccination. Also, children under ages of 3 and also children with disabilities who are under ages of 12 are exempted from having the green passes. Also, depending on the countries and also locations, the implementation of green passes differ. As I said, they can depend on the size of the gathering, they can depend on the purpose of the facility, and some countries actually do not use green pass at all. Also in the US, California is currently the first state and probably out of a few states that mandates vaccination passes to be used in school environment, but many other states do not require them to be used at this point. So we have to really deduce educational information, productive information, and factual information from all of this and implement that to our own system. I personally don't think mandation of vaccine passes is necessary for children, but further expansion of better education, factual information is more of the necessity currently.
Right, to let them know perhaps why such passes or requirements may be necessary then. Professor Shin, how do you respond to the ongoing dispute here on the local front with regard to these vaccine pass requirements for those aged 12 to 17 at cram schools, at libraries and study cafes? What are your thoughts on this?
Well, yeah, so I agree with Dr. Kwok. I think the conflict over this vaccination issue among children is mostly caused by the lack of sufficient miscommunication. Sufficient communication between government and parents. For many parents, I think the introduction of this vaccine pass among kids can be recognized somewhat forceful and negative. But as a medical expert, who makes decisions upon evidence-based science, the COVID-19 situation for kids has changed a lot since the time when the vaccination for kids was started. This reflects a serious situation in which the risk of infection in children is increasing every day, and more severe cases are being reported every day. So I think the government and medical experts need to be more open, engaging, and share all the fact and information with the public so that we can try to raise the vaccination rate among kids voluntarily without the vaccine pass.
Right, which is precisely what Professor Kwok was also trying to say,
Right.
Mm-hmm. Professor Kwok, US authorities have granted the green light, meanwhile, for booster shots, that is, for those aged 16 and above. What has been disclosed about the efficacy of booster shots for these teenagers, as well as the potential side effects?
I think the studies are currently still being conducted, and it's an ongoing study, and no formal results have come out of their side effects or their clear efficacy in those specific age group. I believe Dr. Anthony Fauci mentioned in the prior couple of weeks that even though they're authorizing this vaccination, that's not what he said, but he thinks that it might not be necessary to be used in younger generations. It's authorized because there are growing numbers of children getting infected, and there may be a time when these youngsters also would need booster shots, but at least for the time being, it's not necessary, it's not required, and it's not needed. Number two, Dr. Anthony Fauci also mentioned that from the studies and interim results from ongoing studies, he thinks that children are able to come up with higher, better immunity than older generations. So he thinks that receiving the shot, they might actually have antibodies levels that maintain until well beyond 6 months of time. That's particularly why he doesn't think it will be necessary to use booster shots in these youngsters yet.
Right, and hopefully that will be the case.
I hope so.
Professor Shin, UK authorities have confirmed their first Omicron-related fatality and have rejected talk about Omicron being less severe than the Delta. Mm-hmm. Having said that, what can you tell us about the risks posed by Omicron?
Yeah, so the initial data suggests that transmission of Omicron variant was faster than the Delta variant, and the severity of Omicron was actually less, although the current vaccine are not giving the full preventative effect. However, considering that the fact that the issue of Omicron variant came up only a month ago, we don't have sufficient data to suggest the characteristics of Omicron yet. And we need more scientific data to clearly identify whether the rapid propagation of Omicron is actually due to the high transmission ability of this virus, or if the reduced vaccine effectiveness is the one that causing the high transmission, or it could be the both factors, but we need more scientific results.
Right, and as we continue to fight against COVID-19, Professor Kwok, what are the chances of authorities here in the country perhaps further lowering the age limit for vaccination to include children aged 5 to 11, like your 3 children?
I think that's actually bound to happen. The US has already authorized Pfizer shots to be used for children who are between ages of 5 to 11. They obviously are using different dosages for that certain age group. They make their decisions based on scientific proofs, and we have to make our decisions based on scientific proof, which could be shared globally. So in the end, I think even in Korea, we would eventually see authorizations for the mRNA types of vaccines to be used even in younger children. I guess, as I said before, I am much more than willing to inoculate my children with the vaccines for their own protection. But when the time comes, I hope that we would have reached much higher percentage of vaccination rate, even among not just the elderly, but also teenage group as well.
I hope so too, Professor Kwok. All right, as always, thank you very much for your time and your thoughts.
Thank you.
Professor Shin, thank you for your insights today.
Thank you.